In this video, I'm going to explain a few of the exercises that can be done in patients with carpal tunnel syndrome. Again, if any of these exercises were to cause pain or make your symptoms much worse, then you shouldn't do them. So I've already mentioned that the median nerve runs through the carpal tunnel. Well, along with the median nerve, there also runs 9 tendons that go into the hand. And during the day, when you're doing a lot of that wrist activity that I've been talking about, it can increase pressure on the tendons and increase the symptoms, especially if there isn't much space within the carpal tunnel. So nerve and tendon gliding, which is what the exercises are called, are designed to try to help increase the space within the carpal tunnel syndrome by reducing the swelling maybe of the nerve or the tendon as it's going through the carpal tunnel, because the space is tight when you have carpal tunnel compression, and the idea being if you reduce any of the swelling that might be there, or that's called in medical terms a little bit of edema, that might help the symptoms. So we have a certain amount of physiological gliding. So for people who don't have a condition like carpal tunnel syndrome, movement of the wrist during the day will naturally allow for movement of the nerve and the tendons. So the gliding exercises were designed to help people with carpal tunnel syndrome or compression of the median nerve at the wrist. They were designed by a person called Totten in 1995, and they were initially described for helping patients in the post-operative period, but now they are used as part of the pre-operative management. The evidence for these exercises making a significant difference is low enough. So some studies will say that they do improve the symptoms. Other studies say they don't make any difference to the symptoms, but importantly, there doesn't appear to be any adverse effect of doing these exercises. So if you are suffering from carpal tunnel syndrome and you are using the splint and getting hopefully some relief, and you're maybe waiting to see a surgeon or waiting for your surgery day, or for various reasons you're opting not for surgery right now, they're certainly worth a try. And if they help, great. And if they don't, then there's no need to do them. And like I said at the start, if they cause pain or worsening of your symptoms, then you probably shouldn't do them. I'm going to just explain very quickly what they are. But when I work with the physiotherapist again to do exercise videos, we'll do this as a short video that you'll be able to follow along to. So the nerve gliding exercises, so it's essentially your hand in 5 different positions, and I'll show you what these are. So you start with a fist, and then you put the hand up straight, then you extend back the wrist, then you stick out the thumb, then you rotate the wrist, and then you pull on the thumb gently. So I'll do that again. So you have a fist, hand straight, hand extended, thumb sticking out, turn it around and pull it down. And then for the tendon gliding exercises, again, I'll just show you briefly what they are, but we'll do it as a proper short video to follow along to with the physiotherapist. But essentially the hand is straight, and then you do a hook, and then you do a fist, and then you do a tabletop, and then a long fist. So that's how you do them. So I'll do that again. So you have straight fist, hook, then you have a fist, then you have tabletop, and then you put the wrist, full fist down like that. Or a long fist, I think that's called. And what you do at each movement is you hold it for 7 seconds and then move to the next part of the nerve gliding series or the tendon gliding series, and then you do that about 5 times in each exercise session, and then you repeat it maybe 2 to 3 times a day. There is one final exercise that's called myofascial stretching, and the idea behind this is if you're doing the myofascial stretching, you may then widen the carpal space by widening or pulling on the carpal ligament. So again, there is some evidence for this. It may or may not help, but it certainly shouldn't make things worse. So essentially you'll just have your hand, you'll put it against a wall, it'll be easier to do it that way, and then you essentially pull back on the muscle here. And you'd probably do that maybe for 10 seconds at a time. So they may be of help for you if you are suffering from carpal tunnel syndrome. Like I said in a prior video, the splint is probably going to give you more relief, but if there was something you wanted to try, these would certainly be worthwhile. There's certainly some evidence behind them, and again, if it makes your symptoms worse, just stop doing them.